We would like to share that we believe COVID-19 is circulating in our community. Currently, we have 9 Contra Costa residents who've tested positive for COVID-19 and 1 additional presumptive positive that is waiting for CDC confirmation. This brings the total at this time to 10. We are also continuing to follow 1 traveler from the Diamond Princess cruise ship who's waiting for negative test results before being released from the hospital. Let me summarize our 9 cases and 1 presumptive. 6 of those had no known travel history outside of the US or known contact with another known positive coronavirus case. 2 of the 10 were passengers aboard the Grand Princess I cruise ship, not to be confused with the Grand Princess II that is harbored at the port of Oakland. 2 of these cases, 2 additional cases, had contact with another known positive, and we do expect these numbers to grow in the days and weeks ahead. I'd also like to announce that 6 passengers from the Grand Princess II ship, the one that is harbored off the port of Oakland, are now currently in Contra Costa hospitals. They're not in serious condition, and we have sent their samples in for testing at our local public health lab. I will also mention that our public health lab has received 1,000 test kits, has ample capacity to test all of those folks who are currently in the pipeline, and that it has been announced that 2 commercial labs will soon be online to provide testing for hospitals and clinics, which will greatly increase our local and regional capacity, which may well be needed in the coming days and weeks ahead. Our public health division has been very busy monitoring people with COVID-19, doing what we call contact investigation. They interview patients and those they've had close contact with. As a result of these investigations, we have quarantined a number of people and isolated others. Isolation is used for positive cases. Quarantine is the term we use for folks that are waiting for their test results. 140 of those individuals were associated with the Grand Princess I. We have now screened over 250 passengers that have come in through SFO, and fortunately, not a single one of those have tested positive. I believe we will now be increasingly focusing our attention on community-acquired cases. Given the level of coronavirus in our community, Contra Costa is shifting from a strategy of containment to mitigation. That means we are acknowledging that our efforts to isolate people who are sick and quarantine people who may have been exposed may no longer be enough. Today, Contra Costa is taking additional steps to slow the spread of the novel coronavirus and minimize its impact in our communities. Today, the Board of Supervisors declared a local emergency, and CCHS is also issuing new guidance to our community, which Dr. Radhakrishna will now talk to you about.
Good afternoon. We understand that these recommendations may substantially impact our lives and be difficult to implement. We consider them very carefully in consultation with the state and with other counties who have taken similar actions. Given that we now know the novel coronavirus is spreading in our county, this is a critical time, perhaps the best and only time, for each of us to do our part to protect the community and decrease the spread of this virus that can affect especially the elderly and those with chronic conditions. Our guidance comes from the health department, and these are things that we recommend starting today. We expect these measures to be in place for 2 weeks initially while we test more, gather more information locally and regionally. Respiratory viruses, like the novel coronavirus, need people to be close together in order for it to spread. Therefore, our recommendations involve social distancing. This is a public health strategy that limits the closeness and the number of interactions that people have, so the disease spreads less often. As mentioned, the people at most risk are those over age 50, increasing with every decade of life, and those with chronic conditions like heart disease, lung disease, diabetes, cancer, or weak immune systems. Contra Costa Health Services and Public Health strongly recommends that all large community events be postponed or canceled. That means gatherings where 50 or more people would be within an arm's reach of each other, such as concerts, sporting events, celebrations, religious services, and other community events, with special focus on those that have high attendance from the elderly or those with chronic conditions. If a large event does take place, organizers should review the guidelines from the California Department of Public Health on mass gatherings and ways to mitigate impact and spread. Employers are encouraged to suspend non-essential travel and relax sick leave rules. This means canceling conferences and big meetings and minimizing the number of employees that are working within an arm's reach of each other. We urge employees to stay home when sick and for employers to be flexible about sick leave. Please do not require a doctor's note for sick employees to avoid further strain on the healthcare system. Schools. Public health is working very closely, and schools may need to prepare to postpone, alter, or cancel certain events. We have been in close communication with school administrators from public and private and religious schools across the county and have briefed them on the state guidelines for various scenarios and how to communicate with us so we can make the best decision to protect our student body and our community. Do not go to school if you are sick. Public health will work closely with schools in the districts to determine if a school dismissal is recommended.